Hello, 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 and hello again. Nice to see you here. Thank you very much for always coming in, tuning in to see what we have for you. How is your day? How has been your day? I know it's been hectic. On a Tuesday, it's usually, I wish I could wait till, I can't wait till it's Friday. But hey, we've got something fun for you. And that is talking about Antibiotic Awareness Week. Hey, WHO is saying this week is a week of antibiotic awareness, antibiotic resistance awareness. Yeah, that's it. I lost my word there. So this is what we are about today, and that is let me put that on the screen so you can see. That is about World AMR Awareness Week. What is it about? We will be knowing more. You know, we equip ourselves with information on this channel, and because ignorance is no excuse. Hey, so that is why we are doing this by WHO. This is a time for us to know about this. And if you have friends you think are meant to be here, friends, family, hey, try to call them, try to remind them, and let us all do this together. Our guest is in the studio and she's going to be dishing out information about antibiotic awareness or antibiotic resistance awareness um, um, to us. So what we will do first is to actually watch a clip. I hope I'm not going to be charged for copyright here, but I will bring it on anyway. So it's going to be about a clip talking about, let me bring it on. Yeah, that's the one. So talking about awareness of antibiotic resistance. Now let's listen very carefully as we watch.
Hello everyone, as we gather at this year's UK HSA conference, I'm honoured to share the key messages from this year's ESPAR report with you. Antibiotic resistance is once again on the increase following the declines we saw during the pandemic, with more dangerous strains of bacteria spreading in our communities and in hospitals. Inappropriate and excessive antibiotic use increases the risk of emergence of antibiotic resistance bacteria and associated increased deaths related to these infections. This year's report provides additional analysis of differences in antibiotic resistance burden in England within different populations. Antibiotic resistance we know occurs naturally, but inappropriate use and overuse of antibiotics can accelerate this process. Antibiotic resistant bacteria are less likely to respond to treatment, causing serious complications including bloodstream infections, sepsis, and hospitalization. People who get bacterial infection that is resistant to one or more antibiotics are more likely to die from their infection compared to those who have an antibiotic-sensitive infection. This is why it's important that we only take antibiotics when they're prescribed and necessary for the condition. Whilst we have made strides in understanding and tackling antimicrobial resistance, the journey to combat AMR continues to require us to have strategic focus, continued vigilance, innovation, collaboration, and intensified efforts. Together, we can forge a path towards a safer, more resilient future for us all.
Yes, thank you. Thank you very much. So that is about AMR. Now we bring live on the screen Dr. Diane Oredope. You are welcome on the screen. Yay.
Thank you very much. Thank you for inviting me.
Thank you. Thank you for finding time. You can see she's a busy lady here and there doing what she knows how to do best. Well, she still found time out of no time to educate us. Thank you very much for being here. Now, I know I've just called your name, but we need to know more about you, you know. And so this is where I say, could you please introduce yourself?
Thank you. Yes. So my name is Diane, has been said. I am a pharmacist. By background, I work within public health now. I work in a national institute that protects the nation from infectious diseases. I'm a mom of two. I'm also married to one man, and yeah, I'm passionate about what I do. I'm passionate about pharmacy. I'm also the deputy chief scientist for Royal Pharmaceutical Society, so wear a few hats.
Oh, thank you. So we can see the hats coming. She's gonna be dishing out her stuff. It's her bread and butter, so she knows her stuff very well. And thank you very much. I can see Balogun Temilade. Good evening. Thank you very much for joining in. Thank you for coming here to listen and to share, because we all need to know why antibiotic resistance week. What was the whole about? What's the why is everyone talking about it this week? And so we're going to be learning from the expert herself, and that brings me to my next question. So please, if you're here, well, thank you to those online. Thank you for joining in. Please like, share, comment, write questions. Please write questions, because she's here to answer all of your questions. First question: what are antibiotics and when are they needed?
Okay. So I'm going to start. So antibiotics are probably the ones that most of us know about, and they are used to treat or prevent infections that are caused by bacteria. But there's a bigger group of or class of drugs called antimicrobials. So we may have antibiotics which treat bacteria. So you have infections such as urinary tract infections or skin infections are often caused by bacteria, but not all the time. We also have viruses, antivirals, and those are used to prevent or treat infections caused by viruses. People will be very, very aware now of the COVID-19, which is caused by the coronavirus, but there's also flu, which is also caused by a virus. We then have antifungals. So these are used to prevent or treat infections caused by fungi. Examples are thrush, or ringworms, and or athlete's foot. Those are caused by fungi microorganisms. Then we have antiparasitics, and again, and those are used to treat or prevent infections caused by parasites. Common one that we will be aware of is malaria. So those are the four classes of drugs within the antimicrobial class has those four different types within there. But the most common one that we're aware of is antibiotics, and so often called antibiotic resistance.
Ah, okay. So what exactly is antimicrobial resistance?
Yeah, so antimicrobial resistance is what happens when the drugs that would normally be sensitive to kill so it's when the microorganisms change or mutate over time, and then they get to a point where those medicines are no longer as effective against them. So that's what we call antimicrobial resistance. So when they're sensitive and there are no mutations or changes, you give them a simple or narrow spectrum antibiotic. So that one that works, when we say narrow and broad, we mean those that work on fewer bacteria. You expect that it would treat the patient quickly and that the patient will be able to get better. But when we have resistance, that's when it takes a bit longer, or you have to find another antibiotic to work against the microorganisms. It does happen naturally, so in the sense of these microorganisms can mutate over time. But what we found is that the more you use antimicrobials, unlike other medicines, the more you use them, the more likely you'll have to have resistance occurring with these microorganisms. So it's the microorganisms, so it's the bacteria, fungi, parasites, and viruses that become resistant, not us as human beings.
Ah, so what symptoms? I mean, what should people look out for to tell them they're now resistant to antibiotics? What symptoms should we be worried about?
Yeah, it's a bit challenging. I think, I don't think you can know that you're resistant to antibiotic without a healthcare professional being involved. So I think that what's best is that if we have an infection, I think what we need to make sure we do as individuals is to use antimicrobials only when we need them, so that we can protect them, so that when we do need them, they'll work for us. But if there are certain symptoms that you have, and it may not be about resistance, it could be because of the type of infection is just severe. But there's certain symptoms like, if your skin becomes very cold or a strange color, if someone feels confused or has slurred speech, difficulty breathing, or breathing too quickly or really slowly, severe headache that's just not shifting. They have chest pain or difficulty swallowing or drooling, coughing up blood. Those are some of the symptoms that you'd want to make sure that you get it checked out as soon as possible. That doesn't necessarily mean it's resistance. The way I talk about resistance in the context is, say, for example, you have urinary tract infection and they give you the first antibiotic. As long as you definitely had the urinary tract infection, if that first antibiotic doesn't work quickly enough, it may be that it's caused by resistance, but it may also be that the wrong antibiotic was chosen. So it's really the healthcare professional that can make that decision. And the way they do that is they'll take a sample. It could either be a blood sample or urine sample, and they'll take it to the microbiology lab for testing. And on there, they will then look at it and see if it's resistant or not.
So how do we look after ourselves and our families if ill? Because I know in where I'm from, I know every little thing you'll be like, oh, it's just like paracetamol in some countries, So yeah, I know it's not right. So what would you say if people have issues and they're like, oh, this looks like a bacterial infection, I think I need a tetracycline, this, we even know the names.
Yes.
So how do you take care of your family?
Yeah, I think, in terms of us looking after ourselves, preventing infections is one of the key things. So making sure, and it sounds very simple, but good hygiene in general, good hand hygiene. I think during COVID, we all learned to wash our hands. I think it's really important that we continue to do that and continue to make sure we keep those hand washing going and continue to encourage our children to do the same. If we've got coughs and colds, the importance of, coughing into the elbow and sneezing and throwing things away, that's really important. Vaccination is really important, encouraging that, if you are eligible for flu vaccination, if you're eligible for COVID vaccination or any other vaccination, they're important to prevent infections. I know that people have different views about vaccination, but they are important. And the reason why we have less measles, we have less a range of infectious diseases is because of the vaccination and what they've done over time.
So at what? Oh, sorry. Carry on.
Yeah.
Sorry.
So those are the ways. So preventing infections in the first instance, and then if you are ill, then I think it's if there are certain illnesses that are self-limiting, we call them self-limiting in the sense that they will get better on their own. Whether you take an antibiotic or not, they will get better. Often things like colds and flu, there's no point to taking antibiotics for them. Even if you get better, your body would have gotten better anyways with those, or except it's something more severe and I've given some of those symptoms. But getting plenty of rest. And I know that can be challenging, especially if we've got children to look after, if we've got work to do. But rest is really important. Drinking enough water so that you're not feeling thirsty. And then fever is a sign. So when we get hot and get that temperature, it is a sign that the body is fighting the infection. And it will usually get better in most cases. So you can use paracetamol if you're feeling uncomfortable to try and calm things down. And so those are some ways in which we can look after ourselves. So self-care really helps.
Yeah, thank you very much for that. Well, thank you to those who are joining in. You're wondering, what are we talking about? We're talking about antibiotic resistance awareness. It is ARW.
WAAW.
Oh, okay. I can actually see it on there. Week. Well, World Antimicrobial Resistance Awareness Week this week. So we're talking about how to use antibiotics, when not to use them, and when to run away from them if we can. I know there's this thing about people. Well, there's a campaign about not using antibiotics very often, and that takes me to my next question. In the UK, you don't even get to see. I've never seen an antibiotics before. Well, some people use it, maybe the elderly or prescribed, but it's never off the counter medicine. People, but in a country where I know I've been to, I don't want to start mentioning countries now. Well, in some countries, you can just go to the chemist and they just give it to you like that. I was surprised when I got here and I was like, I've never seen with my eyes the red and yellow capsules or whatever. You never get them. Even when you ask for them, they'll tell you no, like it's kind of forbidden. So what do you think countries need to do more, to prevent this from being a big issue? Because it is at the moment. That's why we're creating an awareness about it, isn't it?
So it's a bit of it's challenging in the sense of, so I will say that in the UK, yes, you're right, you cannot buy antibiotics without prescription. There are opportunities for pharmacists to assess a patient and say they require an antibiotic and give it to them if it is, but they will look at other things first before they go to an antibiotic may be needed. So there's several things they need to go through. And generally, the reason why we want to protect these medicines is because of what I said, is that the more we use them, the more we are likely to get resistance, and then it makes it more difficult to treat infections in the future. What should countries do about it? So if you actually look in these countries that you're talking about, and it is across the different continents, will be admitted, it's not just in a particular continent, across the different continents, it can be easier for people to access antibiotics. But I think if you look at the law for those countries, antibiotics are meant to be given by a healthcare professional, not being sold. That's the legal status. I guess the challenge is policing that. But the other bit with some of these countries, though, is the fact that the healthcare systems are so challenged that for a patient to get to a doctor can take days for them to walk there. So there is that challenge then of actually, how do you make sure that people are not ill and not accessing medicines versus that? So there's a lot of work ongoing, and I think it's really about us getting a better healthcare system, and then some of these things will work through. I do say though that if there are healthcare professionals before they, it is important that they're trained, so that they are making sure that they're giving patients appropriate medication, because we all sign a oath or a promise when we become pharmacists, doctors, nurses, that we will do the best for our patients.
Yeah, thank you very much. That was spot on. Thank you. Georgina Small is here. Thank you very much for joining in. You're saying, amen. May we be blessed with an amazing God-given immune system. Yeah, where our body fights diseases even without us realizing
and it
it.
does.
So that's the way.
And it very much does. And that's the important part about us keeping well, in the sense that most of the time, these self-limiting infections will get better on their own.
Yeah, on their own. Thank you. Thank you. Another question is, what are or can healthcare professionals do?
Yeah, so in terms of what healthcare professionals do, I think, we've talked about the importance of them only or making sure that they've educated themselves, so that they are, they are giving the right advice to patients. In most of the countries, there will be tools available to support healthcare professionals. So in the UK, for example, we have tools for primary care physicians. We have tools for secondary care physicians and surgeons and pharmacists. And those tools are there for them to use so that they can make the right decision when a patient comes to them with illness. So I've talked very quickly now about, the warning symptoms. These tools are available so that the doctors or the nurses or the pharmacists can work through them and ensure that they're giving the patient the right medication for themselves, medication that they need. So I think for healthcare professionals on the call, it is around, using those tools. So if they're in primary care, the tool is called Target Antibiotics. If they're in secondary care, the most common one is Start, Smart, then Focus. Secondary care being hospitals, sorry.
Yes. Thank you. Georgina says, I think we need more teaching, especially parents, on what gets better alone and what absolutely needs antibiotics. With our children, we don't rush to the doctors. When I had my first one, every little thing I was always rushing to the doctors. Well, you won't blame me being the first one, but when the second one came out, she'll get over it.
Experience, right? Experience.
I'd learned,
with experience, we get, yeah. So I think in terms of thinking about I think with children, it can be challenging. And I think that one thing we say to parents is that your child. You will know if something is really not right.
Really,
and and I think one thing to be clear about is that nobody's saying that people should not access the health system, because it is there and the doctors are there to support us. But you're right in the sense that we don't want to go every time. But anyways, in terms of what gets better on its own, generally it's colds, flu, they get better without antibiotics. Vomiting, as long as it's not an infectious one. Most coughs, not all coughs, most ear infections, most sore throats, and most diarrhea. So it's really challenging. And I think what I would say is that they can ask the pharmacist for advice. If you're not sure, ask the pharmacist for advice, or if any of those warning symptoms come up. The things that definitely need antibiotics, and it's going to be difficult for a parent at home to understand this, is pneumonia, urinary tract infection, it's challenging, or sepsis. So it's going to be very difficult for a parent to be able to diagnose that. So I think the key thing is knowing those warning symptoms and when you should worry. And I highlighted some of those earlier.
Yeah, thank you very much. To our viewers, are there any questions you have for our guest today, so she can throw more light on whatever we feel we need answers to? So please type in here your questions and let us all do this together. And there's another one. Okay. It says let's see, I think we need more. Okay, no, it says oops, sent too early. We give ourselves time to see if our bodies get better first. Yes, I was the same when I was a first time mom. I was worrying all the time. Second, third, etc. You end up becoming a nurse yourself and recognize things to be worried about. Yes, you are spot on with that. Thank you very much, Georgina. Thank you. Yes, so because I remember there was a time my first one had a cough and I was watching first day, second day, third day, 1 week. I said, this thing needs antibiotics. I went to the doctor and said, please, can you recommend it? I said, no, we don't have to. I pestered them so much and they were like, okay, they need to do a test. So they went through all the x-rays and all the, I exposed my child to x-ray, which was not up to today. I'm like, oh, what was I thinking? Well, anyway, but it went by itself. It went on its own. So
coughs can last up to 3 weeks. Coughs can be up to 3 weeks. Colds can be 14 days, and sore throats can be 7 to 8 days. So some of them are not, they're not short things, but they will get better. But the key thing is, if you are worried, it is better for you to ask. I think, pre-COVID coughs, we were very clear, coughs 3 weeks, but since COVID, that was the main symptom initially. So there's a balance now to consider. But I think, the key thing is we all know our children. I was a bit the opposite way in the sense of I didn't take mine, but that's for obvious reasons. And I only take them because my husband or my mum-in-law or my mother have made me feel guilty. And then I'll get to the doctor and say, oh, I think this is this and it should be fine, but just in case, because then I was more worried about
a second opinion.
What if I got it wrong?
Yeah.
So usually it was guilt from everybody else that used to send to the doctor.
Yeah. Wow. Okay. I know we're going to be rounding up very soon. I just want to ask this question: how much of an issue is this worldwide? Because for World Health Organization to say this is a week for us to create awareness about this antimicrobial resistance, then it must be a thing. So what would you say? Have you got statistics? Have you got, what can you equip us with so we can tell others?
Yeah. So, when we have the drug resistant microbes is more difficult to treat and almost impossible for some vulnerable people who have weak immune systems. So it's really important for everybody. And you're right in the sense of the numbers are increasing across the world, increasing in all countries and across the world. If we don't have effective antibiotics, I think key thing to highlight is that cancer treatments and common surgery like cesareans will become more high risk procedures. And so that, the infection could be what is actually what becomes fatal rather than the cancer or things like that. There was a global review that was done a few years ago, and it said that if we do not take action by 2050, and when they did this, it felt like a long time away, but it's quite close now, that 10 million people each year will die because of resistant infections. And majority of these are actually in low middle income countries. So it's really important that we preserve them. And actually what's happened recently is that they've looked at the estimates again, and the numbers are actually high, and they're getting higher. I think the other reason why we need to think about this is the fact that, before penicillin, for example, 1 in 10 healthy young people died from pneumonia and skin infections. But because of antibiotics, it's now 1 in 100. And deaths from child-related sepsis was 3 in 100 before antibiotics. Now it's 3 in 100,000. So it's really important that we keep these medicines working, and to make sure that we don't lose them. So the numbers are scary. And for me, the reason why I became so passionate about tackling AMR, which went beyond my day job, is because I watched the story of a girl. Her name is Addie, and it was a story. She was in America. She was based in America. This was a few years ago, and she was playing. She went out and played normally. She had a bit of a scratch. 2 days, 3 days. By the third or fourth day, she was in hospital, and she stayed in hospital for 5 months. Had a double lung transplant, and left in a wheelchair because she had an infection that was resistant. At that point, I just thought, that can happen to anybody. And that's why, for me, I became quite passionate about tackling AMR. So it is something that we need to be careful about. And it does happen. It can happen to any of us. Anyone.
Yeah, thank you. Thank you for saying that. So it actually leads to death. That's why this is a biggie for every one of us to take note. And thank you. Georgina says, is this, she's asking a question, is this why we have superbugs? Because of the overuse of antibiotics?
Yes. So superbugs are basically when the bacteria or the microorganism is now resistant to more than one antibiotic or several antibiotics, and that's when they're called superbugs. A common one that we might be aware of is MRSA. So that's one example of what is considered a superbug. But yes, overuse is one, but also sometimes not preventing the infections, us not being thinking about the infection prevention and control measures, is also another reason. So it's not all only overuse. It is, but it's one of the most important reasons. Yeah. So, and the key thing is that every time you use an antibiotic, so that's another key point. So every time you take an antibiotic, you increase the chances of resistant organisms growing in your body by 2 times, and that can last for more than a year. So that's why it's really important we take those medicines only if we need them. So the risk benefits.
So can you say that again? Every time you take an antibiotic, you increase the resistance.
You increase the risk of you having resistance.
Oh, the risk
of you having resistant organisms in your body.
All right. Okay. Actually, I've done an error spelling resistance, but anyway, you know what I'm talking about there, everyone. So thank you for joining in, everyone. Finally, would you be able to tell us where to find more information? Because that is very important. I'm sure some people will be like, well, I've been taking antibiotics all my life, and I think I need to turn a new leaf. So where do I get more information? Or maybe they want to send it to people. Where can we find more?
I think the one website that I would really recommend that everyone to look at is the Antibiotic Guardian website. So you can see it on my back there. So it's www.antibiotic-guardian.com.
Let me go into the see.
Yeah, that would be great, actually. So on that website,
so let me do Google.
On that website, it gives you a whole.
So can you tell me what
antibiotic-guardian.com.
Antibiotic Guardian. Yeah. Okay. Let's see. Yeah. Antibiotic-guardian.com. Okay. Yeah, this one. Is it this? Or am I not showing it?
Yeah, no, that's it. That's exactly it.
Yes.
That's the right one. So and then if you accept the cookies, so on that website, there are different pledges for different groups. And it gives you a little bit of information, you can watch the video. But if you scroll down, it tells you to choose a pledge. And if you choose being a member of the public, for example, and then you can choose if you want to pledge as an adult or
Okay.
as a family, so somebody that has young children. So in fact, when I led the creation of this campaign through Public Health England, as it was then, I chose a pledge as family. But so if you choose if we just go back up a little bit, so if you choose one of the pledges, maybe if you choose a family one, so
Okay.
on there you'll see that if you have pets, you can also choose as a pet owner.
What is that pledge about? Meaning, what are you
So,
saying that
so
pledge? I'm not going to be taking antibiotics. So
no, it
what
gives
is
you
that?
the different actions. So if you click on it now,
Oh,
so
okay.
I'll show
Family.
you, it'll give, so families, if you scroll down and
All
then it gives
right.
you a range of options for you to choose from.
Okay.
So, I think you can choose,
Oh, okay. I
washing
see.
hands. So these are some of the actions I
Yeah.
said we need to take to prevent the resistance.
Mm.
So washing hands,
Oh,
vaccination, or, if you have self-limiting infections, so you'll see a pharmacist. So there's a
yeah.
range of things there,
Oh,
or
okay. Okay. I see.
educating children with the ebug resources, and then you
Oh,
click that. But
okay.
again, if you're a pet owner, you can choose as a pet owner. If you have horses or a farm, you can choose that as well, and
Um,
then you just provide details, and then we share information over time as well. And there are other
oh,
resources on that page as well, including patient stories and a range of resources.
oh, great, great. So that's it. So for us to know what to do as a family, like someone was asking,
Yeah.
how do I take care of my family when they're ill? This is what we need to know about. So, antibioticguardian.com is the place to go for more information, and you can always see what's it called now? Get to speak with someone if you want to, or send an email, or if you need more information. So thank you very much. I really appreciate it. I've really enjoyed my time here. I'm sure everyone has. Thank you so much for spending your time to educate us and
Thank
creating
you for inviting me.
awareness. Thank you.
Thank you very much for inviting me.
Thank you. Thank you very much. And we'll speak to you later. Thank you.
Take care. Bye.
So you've heard it all. You've heard it all. What do we need to do with this information? Keep it under our beds or spread it out? You decide. What would you be doing with this information? Thank you very much to Georgina Small. Thank you very much for joining today. Thank you, thank you, thank you. Thank you to Temilade Balogun as well, who sent a message earlier. Thank you as well. And to as many who are behind the scene, who are not typing but are listening, thank you for your listening ears. And I will say, see you next time with the next thing. Hey, it's going to be dentistry next time about teeth. Do you know that you could actually, let me not let the cat out of the bag. The next one is speaking to a dentist, and she gave a wow information that you would normally not think about. So stay tuned for next time as I come your way. Stay tuned and please share, like, subscribe, and press the notification so you don't miss out on any of our videos when we come up online.